Hello, everyone. I'm Valerie Mooring. I'm the Healthcare and Cybersecurity Team Lead here at Edafio Technology Partners. We wanted to talk to you guys today about a new guide that we have published. We released a guide on telemedicine billing for the COVID-19, the public health emergency. It's really nice to have that type of information in one document for all the different payers, because as we know, payers, they don't all want the same G codes, or they don't all pay for the same things. They don't even reference, that one payer may call it a virtual visit or a virtual check-in, and someone else may call it something else. But then if you look at the services description, then they're actually saying, yes, you need to use, the audio portion and the telephonic portion. The other confusing piece that's out there right now for a lot of our clients and practices is Medicare and other private payers pay for services like chronic care management and just regular telephone encounters and telephone visits. And so really implementing and making sure that providers, nurses, everybody that's really taking care of the patient and documenting that in the medical record, assuring that, we're all on the same page, right? We're all talking about an actual Medicare telehealth visit versus a virtual check-in that another payer calls it with that type of terminology. It can really get confusing, and so we all have to kind of recenter and say, okay, this is what we're talking about for this specific payer. We're talking about a Medicare patient that is getting this type of service from Medicare, and this is how we need to make sure we're documenting that in our electronic medical record, so then our billers, our coders can turn around and bill for that service. We look at Arkansas Medicaid, and with the DMS memorandums that have come out, there have been multiple. At this time, the guide is really only covering for our federally qualified health centers and rural health clinics, COVID-19 testing and screening procedures, but they have been having weekly calls at Arkansas Medicaid that Edafio healthcare consultants have been listening in on every week to see when they're going to roll out additional codes and billing information for true telehealth visits. So we know CMS has approved those. The states are really just working through different processes, including the state of Arkansas, in order for federally qualified health centers and rural health clinics to take advantage of that.
The beginning of the guide basically just focuses on each individual carrier that we've listed in there, and it kind of gives a little bit of information about their policies and their procedures and some guidance from them on the COVID-19 public health emergency. And I think the biggest part of this billing document that will be the most useful, especially to your coders and your billers, is a chart at the very end where it's going to list out the latest updates, the date of the latest updates, the carrier, what codes are being covered, along with what type of visit it is, what place of service, what modifier, and a link to that carrier's website so that it takes you straight to where you can find the coding and the billing updates for COVID-19 services. And then there's also a list at the very end of all of the different CPT and HCPCS codes that are covered, along with what type of provider can bill for those services, because with this public health emergency, CMS has allowed additional provider types to be able to bill for some of these services. We give you some documentation guidance on what the requirements are to be documented for specific types of telehealth visits. And then it'll be a really good resource for your coders and your billers to have next to them as they're entering charges to bill for all of these different visits. So it's really a good one-stop shop to help you with all the major carriers here in the state on how to build these codes and these services.
Thank you guys so much for joining Lori and I today for this brief overview of our telemedicine billing guide. If you want to learn more information about our services, email us at info@edafio.com. And if you'll check your screen out now, you will see a link in which you can download the guide. And we really just want to say thank you to all of our healthcare heroes and everybody who is out there taking care of patients day in and day out. We really applaud everything that you're doing. So thank you again for taking care of us.